If you're someone with unexplained reactions, flushing, food sensitivities, anxiety, brain fog, palpitations, or feeling like your body is constantly on edge, here's what I would do differently today. I would stop chasing symptoms and start stabilizing mast cell behavior first, because when you understand this layer, outcomes change dramatically. What fails in the old approach is treating mast cell activation like an allergy instead of a systems problem. After years of seeing the same patterns repeat, especially in patients who were dismissed or told it was just anxiety, I now recognize this earlier. And this matters now, not later, because the longer mast cells stay unstable, the harder the body becomes to treat. Let me walk you through how my thinking evolved. If you're new here, I'm Dr. Fred Bloom. I'm an integrative and holistic physician, and much of my work is with people who have been sick for years despite doing everything right. If this resonates, feel free to like the video, subscribe to the channel, join the newsletter, and leave comments, especially if parts of this match your experience. One of the most common things I hear from patients with mast cell activation is confusion. They're told their labs are normal, that their reactions don't make sense, or that stress and anxiety must be the cause. But here's the reality. Mast cells sit at the intersection of immunity, inflammation, hormones, neurotransmitters, and detoxification. When they're unstable, the body becomes reactive to everything. Early on, many patients are told just to block histamine. And while that can help symptoms temporarily, it rarely creates stability. What gets missed is this. Mast cell activation isn't just about histamine. It's about how the body handles inflammatory chemistry. Earlier in my career, I thought that if we controlled histamine, symptoms would calm down. And sometimes they did, briefly. What I didn't fully appreciate then was how bottlenecks in metabolism keep mast cells reactive even when histamine intake is low. Experience taught me that many patients weren't overproducing histamine. They were unable to clear it properly. And even worse, sometimes converting it into more irritating forms. That shifted everything. Now, instead of asking, how do we block this reaction, I ask, where is the traffic jam? Here's the pattern I see repeatedly. Histamine has multiple ways out of the body. If even one of those pathways is sluggish, histamine accumulates, mast cells stay activated, and symptoms spiral. I now look at 3 core questions early. How much histamine is coming in? How efficiently is histamine being broken down? And what happens after it's modified? If histamine is methylated but can't move through the next steps, it becomes even more irritating. That's when people say, every supplement makes me worse, or I can't tolerate methylated vitamins. This isn't random sensitivity. It's biochemistry under strain. When I see this, I slow everything down and stabilize the terrain before adding anything aggressive. This is often missed because medicine is siloed. One doctor looks at allergies, another looks at hormones, another looks at mood. But mast cells don't live in silos. They respond to estrogen, stress hormones, neurotransmitters, infections, and toxins all at once. Time-limited visits, reference range thinking, and protocol-driven care make this easy to overlook, even with good intentions. This isn't about blame. It's about recognizing complexity. When mast cell stability becomes the first priority, everything else becomes easier. Patients tolerate treatment better. Reactions decrease. Progress stops stalling. Instead of layering supplements and hoping something sticks, the sequence becomes intentional. We reduce incoming load, support clearance, calm immune signaling, and only then move deeper. That shift alone often restores trust, both in the process and in the body. This is especially relevant if you have unpredictable reactions, food sensitivities that change daily, anxiety that feels physical, or worsening symptoms with helpful supplements. It requires nuance. Not everyone needs the same approach, and this is never a one-size-fits-all. When mast cell instability is part of the picture, ignoring it usually delays healing. What I want you to take away is this. Your reactions are not imaginary, and they're not random. They're signals. When mast cells are understood and stabilized early, the body becomes cooperative again. If this was never explained to you this way, you're not alone. I'm curious, has anyone ever connected these dots for you? Does this help explain why treatments kept failing? And would you want a deeper breakdown of how mast cells interact with hormones, infections, or detox pathways? Let me know in the comments.